Hey, you guys. Oh my gosh, my thing just fell. That's good. Let me get this adjusted real quick. Sorry about that. Okay. Welcome to tonight's call, which is Get Off the Stress Express. I know that there's going to be some of you able to join live, and that is awesome. And then there's going to be others of you that are going to watch the replay. If y'all would just let me know when you watch this, if it's live or if you're watching the replay, kind of helps me gauge who saw it and when. So I want to start off tonight by telling you guys that we're going to focus specifically on the hormones related to cortisol tonight, or to stress tonight, which in particular is cortisol. So basically there are two hormones that your body cannot live without. One of them is cortisol, which is a stress hormone produced by the adrenals, and then the other is insulin, which is made by the pancreas. Now, let's set aside the crazy times that we live in right now. For most of us, stress is really just a part of our daily life. We've got jobs, we have kids, we have school. We call seasons like that or situations like that acute stressors because they may only last for 15 minutes in the morning in the school drop-off line, and then maybe the rest of your day is kind of easy peasy. Or maybe you've got a particularly stressful afternoon with hustling between work and getting kids to activities or something such as that. But those are what we refer to as being acute stressors because they may only last for a few hours. Sometimes it's a few days. I think about like college kids taking finals, and I can remember back on that and how stressful finals were, or even when I taught and it was the end of 6 weeks, or now with my job closing out the end of a month. So it can even go over the course of a few days, but is not something that is happening for a chronic or long-term period. And so I kind of want to differentiate in the beginning between acute stress and chronic stress, because acute stressors are normal. I mean, I can't think of anybody that I know that doesn't have some form of that kind of stress in their life. This is the stress, like I said, that happens in your life. But when we talk about chronic stress, we're talking about how it can take a toll on your immune system, on your hormones, on your health in general. And this is the kind of stress that happens when whatever is going on in your life surpasses your ability to cope. And the body shifts into producing excess cortisol in order to help you power or push through in the beginning. So the truth about cortisol is that in reality, it should be and can be our friend, because in short spurts, it can actually help to boost your immunity by helping to limit inflammation. But over time, if it goes unchecked, if you slip from that acute stress season into a season of chronic stress, then it can actually create inflammation in your body, and that can have devastating effects on your health. Stress also reduces your lymphocytes, which are essentially white blood cells that help your body to fight off infection. So the lower your white blood cell count, the more susceptible you are to viruses, to bacteria, to other things that can make us sick. High stress, also cortisol has very damaging effects on the brain and on the gut as well. It's been known to produce depression and anxiety. This again is a byproduct of inflammation as well, and it points to your immune system being tired, being worn out, and it cannot protect you the way that the Lord created it to. Stress also has a very direct effect on the gut microbiome because it can easily shift the balance of your good bacteria to bad bacteria in the wrong direction. Bad bacteria can be wiped out if the sympathetic nervous system is on overdrive. And the gut microbiome obviously plays a large role in our immune system and our immune health, being that 70% of our immune system resides there. So real quickly, I want to talk to you guys about blood sugar, because you can't address issues related to cortisol and issues related to inflammation if you don't address blood sugar. So let's break it down the way that it should look. So let's say we have, I don't know, I'm trying to make up a name, Sherry. And Sherry, or an individual, is faced with a stressor. So basically this complex hormone cascade ensues, and the adrenals, which the adrenals are two walnut-sized organs that sit atop your kidneys at near the base of your spine. And their job is to secrete cortisol and other stress hormones like adrenaline, epinephrine, norepinephrine. We don't need to get into any of those for tonight's purposes. And what cortisol does is it prepares the body for a fight or flight response by flooding it with glucose. That glucose is there to supply an immediate energy source to your larger muscles. So think of prehistoric man, bear comes out, huge surge of adrenaline happens, so man can outrun bear. Or we've all heard the stories in today's society of like a woman lifting a car off of her husband because the jack collapsed, and all of a sudden she has this superhuman strength. Well, the large muscles need that to be able to react quickly. One of the things that cortisol does do, however, is it inhibits insulin production in an attempt to prevent glucose from being stored. It wants to be able to use that glucose immediately, again, so that it can outrun the bear or lift the car or do the whatever. And so if cortisol goes up, insulin can go down, or it's not being utilized properly. And like I said, it favors the immediate use of that glucose or sugar that's in the blood. It also narrows the arteries so that epinephrine increases the heart rate, both of which force your blood to pump harder and faster. So think about that like in movies where there are what they call jump scares. And it's like, somebody jumps out of nowhere and you freak out and throw your popcorn. Well, that's that adrenaline and that epinephrine surge that kind of, the pupils dilate, everything feels kind of alive. I mean, that's the reason they call people like adrenaline junkies, because they actually like that feeling. I personally cannot stand it because I've lived with that and it's miserable. Now, if this all works perfectly and according to plan, and this is an acute, stressful situation, then the individual addresses the situation and everything resolves and goes back to normal. The hormone levels all return back to normal. But what if 6 doesn't happen? What if you find yourself stuck in stress mode? What are you going to do to get out of it? Well, one of the first things that you have to understand is if your body is stuck in stress, if it's stuck in fight or flight, if it is stuck in this constant surge of adrenaline happening, then you're going to have, as a result, a blood sugar imbalance. Under stressful conditions, cortisol, as I said before, it provides glucose by tapping into protein stores via a process called glycogenesis in the liver. Again, I don't want to get too technical, but this energy can help a person fight the bear, or you run from the bear, right? But when those cortisol levels stay elevated over long term in the bloodstream and the body is producing too much glucose, that leads to increased blood sugar levels. So when people talk about having high blood sugar, this can be a part of the reason why. So one way in which cortisol may be involved if you've experienced stress-related weight gain, I know that we've heard lots of people joke about like the quarantine 15 or, quarantine pants and things like that. And we're seeing people say that they've gained 15, 20 pounds during shelter in place. They may think that it's because of mindless snacking. I'm bored or I was up late, and so I ate an entire sleeve of Ritz crackers, or I ate an entire, package of some kind of cookie or something like that, or you find yourself craving carbohydrates and things like that. One of the reasons why it can be involved, cortisol can be involved in weight gain, is because it goes back to that blood sugar insulin problem. Consistently high blood glucose levels along with insulin suppression. So remember, we talked about that insulin going down. It causes cells to become starved, essentially, of glucose, which is what they rely on for energy. So they're crying out. Your cells are crying out for energy. And the way that your body regulates this is to send a hunger signal to the brain to say, feed me. And very often that hunger signal is driven by something that, again, provides immediate energy to the body, which is in the form of sugar, simple carbohydrates. So things like chips and crackers and bread and things that the body breaks down, those kinds of carbohydrates that are broken down quickly to give energy, but also can leave you with what we refer to as like a sugar crash or a carb crash or a carb coma, instead of doing what we should do, which is, snack on fruit or vegetables that are more complex carbohydrates that take longer to digest. Therefore, they're not as quick an energy source. But as those cells are crying out for energy, like I said, it sends hunger signals to the brain. This can lead to overeating. It can lead to eating the wrong things, making not good food choices. And of course, any of that unused glucose, the only thing that the body can do with it is store it as excess body fat. So if there's not a way for the body to use it and burn it for fuel, then it gets stored as fat. Another byproduct of your cortisol levels being too high is that your immune system starts to become suppressed. So even though cortisol functions to reduce inflammation in the body, so typically when we think about inflammation, we think about pain, we think about swelling or redness, like when you get a bug bite, and obviously the body is sending cells there to help speed healing. But over time, again, when the cortisol stays too high, these efforts to reduce inflammation also start to wear down or bear down and suppress your immune system. Chronic inflammation helps to keep chronic inflammation is caused, again, by not just cortisol, but contributing factors can be a poor diet along with stress. And those two things will keep cortisol levels soaring. They'll keep it going high. So stress unmitigated combined with a poor diet, combined with being sedentary, etc., can absolutely wreak havoc on your immune system. Can also lead to digestive issues. So in a cortisol flooded, stressed out body, when food is consumed, digestion and absorption get compromised. People can develop indigestion, they can get bloated, they can get gassy, and they can experience things like constipation or diarrhea, or a combination of the two. So if you are finding yourself or what you're experiencing echoed in my words, know that I'm going to give you 5 takeaways tonight to help you get off that stress express. So I'm going to jump into those real quick because I don't want to keep you guys too long. So here are my 5 tips for getting off the stress express. First of all, testing. I think I shared in a live not too long ago about how I wanted you guys to learn from my mistakes. Maybe it wasn't a live, maybe it was a post that I did about how there can be I want you to think about like a Venn diagram. Remember those from middle school and high school where you've got the 3 circles that kind of overlap one another. And when you look at symptoms related to low cortisol, high cortisol, or a mixture of the two, there's going to be an overlap in some of the symptoms. This is the reason why we can't go by symptoms alone when it comes to cortisol, because you can, as I said, you can be high, you can be low, or you can have a mixture of the two. And most people that I see have a mixture of the two. And it's really important for you to test so that you know, because the way that you treat them are completely and totally opposite. So I've mentioned before the 2 types of testing that I recommend for cortisol. This is one where I do not recommend a blood measurement, because when you test via blood for cortisol, unless you go at 4 different times during the day and have them take a read, it's kind of like when you take a screenshot from your phone. It's what you're seeing right then and there at that moment. It's not a good indicator. A lot of doctors, traditional doctors, if you say, well, could you test my cortisol? They're going to do something called an ACTH stimulating test. And basically, they're gonna shoot you full of adrenaline and see how your body reacts to it. That's the way that they test for the autoimmune conditions related to adrenal insufficiency, such as Addison's disease. That, for our intents and purposes, that's not what we're talking about. We are talking about adrenal fatigue, which is different from having Addison's disease or Cushing's disease. So the recommended ways for measuring would be, one is called the Dutch test. It's a relatively new test. It's been around for maybe 5-6 years. You do it by testing, you urinate or pee on a strip, let those dry, and it gets sent off to a lab. Those are only able to be performed by physicians. It does have very valuable insights. So if that's something that your practitioner recommends, okay. It also takes a highly skilled practitioner to read them. The way that I have my clients test is through a saliva test. You can order it yourself, unless I think the only state that you can't is New York. And it is where there are 4 key points during the day, one in the morning, one at noon, one at around 5 or 6, and then another at bedtime. Just what it says, saliva, you spit in a vial, you send it back off to the lab. It takes about a week to 10 days to get your blood or to get the results back, but it's essentially going to show you how your cortisol is behaving throughout the day. If it's behaving correctly, it's at its highest point in the morning, and then it drops throughout the day like this. But oftentimes I see people where it's too low in the morning, so they have a hard time getting out of bed and functioning, and then it just kind of yo-yos throughout the day. But you can't make any assumptions. I always recommend your first goal in getting off the Stress Express is to test and see what your cortisol is doing. The next thing is, I told you guys a few minutes ago how profoundly impactful the blood sugar issue is when dealing with anything associated with cortisol and the adrenals. So you have to, I talked about that relationship between cortisol and insulin, how as cortisol goes up, insulin gets suppressed, and the body starts cranking out blood sugar. This is oftentimes where people start to get a diagnosis of either prediabetes or insulin resistant, because the body is no longer recognizing the correct way that should be functioning. So when stress becomes chronic, it's extremely difficult to heal it if blood sugar imbalances are not, if they're not addressed. The body will remain starved for energy. And as I mentioned before, this leads to that never-ending cycle of the body looking for that quick burst, either from caffeine, from sugar, from starchy foods, simple carbohydrates. So getting your blood sugar under control is going to be a very important step towards your healing. The other thing that I mentioned a minute ago about how it can impact the body is your gut health. And that relates directly towards not only your mental health, because we refer to the gut as the second brain, because a large percentage of your serotonin is actually made in the gut. But also the gut, once the gut goes south, everything kind of starts to go south. It starts to implicate not just your cortisol hormones, but some of your other female hormones and things as well. So I told you guys this would be a frequent topic of conversation in this page. And the reason being for that is that universally most health issues can be related or traced back to poor gut health. And like I said, it's a very slippery slope in terms of the immune system. There are clinically documented strains of probiotics that are known to help the body lower stress, help to decrease anxiety, and help to restore gut microbalance. If you find yourself, I actually shared this with somebody today, that I am somebody that if you were to ask me, are you feeling stressed? I don't have an easy time identifying stress in my life. My body typically tells me that I'm stressed in some way. It screams at me somehow, whether it's some kind of like chronic inflammatory issue, or whether it's me clenching and grinding my teeth at night, or just, used to when I taught, it was catching every sickness that was out there. And I've shared with you guys before that in my journey to health, not once did any doctor, functional or otherwise, ever talk to me about the implications of poor gut health. And I know that my gut health wasn't good. I had psoriasis. I remember a doctor asking me one time about my bowel movements, and I was like, well, it's either kind of feast or famine, like I could go for a couple of days without having a bowel movement. And every day that you go without having a bowel movement, at least one, ideally 2 to 3, you are continuing a cycle of your body holding on to hormones that it should be eliminating. So I can't preach the gospel of good gut health enough to you guys. The fourth thing that I want to talk to you about is inflammation. Time magazine, probably 10 years ago, had inflammation as its cover story, naming it as the silent killer. And I talked to you just a few minutes ago about how we can think typically of inflammation as like, oh, my joints hurt, or there's some kind of pain or redness or issue going on in the body. But you can have high inflammation levels and be completely and totally unaware. That's why they call it the silent killer. So it's the reason that a lot of clinicians and coaches like myself recommend that you get what is called a C-reactive protein, or a CRP test done as part of a testing panel. Elevated CRP levels will not tell you where inflammation is in your body. It can't pinpoint like, oh, you've got inflammation and it's in your ankle, but it will alert you if inflammation is present, if it's problematic, and you're going to want to use probably a combination of therapies such as omega-3 fatty acids, switching to a low inflammatory, healthy fat, good carbohydrate diet such as the Mediterranean diet, and then also doing things to manage and mitigate your stress, because stress drives inflammation. So getting your stress under control is absolutely key. And that brings me to tip number 5, to get off the stress express. And this involves 4 what I consider to be pillars of recovery. And those are movement, breath work, sleep, and grounding. So like I said, these are my fundamental pillars to recovery. Movement should be low impact and shorter durations. While there are a lot of people out there that love to go for a good long run and they love the endorphins that it releases, for anybody dealing with high or low cortisol, it can actually make you feel worse. There actually is within the umbrella diagnosis of adrenal fatigue. And I want to side note on that real quick. I want you to understand that adrenal fatigue, as I mentioned before, there are actually 4 stages to it. And it starts typically with cortisol going high. When the body can no longer meet the demands of cortisol, that's when you start to see that jankety mix of high and low. And then as you progress into stages 3 and 4, it's where you start to see it just be low until it's essentially flatline. And those are people who really, really, really struggle. Like many of them are bedbound. So there's this phenomenon called exercise intolerance. And how many of you, you can raise your hand virtually, have been told by your doctor, well, you just need to eat right and exercise. You need to start an exercise program. And you go and you do the exercise, you get on the treadmill or you get on the elliptical or you take the Zumba class or you do whatever, and it ends up making you feel worse. You can't get out of bed the next day. Your body literally hurts all over. Your joints are screaming at you. You feel like you had less energy after doing the exercise, even up to a couple of days later, than you did before. This is evidence of exercise intolerance. And again, if you go back to what I talked about, remember that when you're in this state of adrenal fatigue, your large muscle groups are starving for energy. So doing some kind of very intense workout is very counterintuitive. What will benefit you more is walking. And it doesn't mean trying to get 10,000 steps in one session, but taking 5-10-minute walks during the day. Walking is an excellent form of exercise, and it's also great to be outside and get into nature because that can be healing as well. Another recommendation, and this one is really good for people who maybe fall into that higher cortisol situation and possibly are dealing with a thyroid issue as well, high intensity interval training, or HIIT or height, depending upon who you're around and how they say it. But this is where you just use your own body weight for the exercises. So it's like doing short bursts of calisthenics, and then you have a short recovery period, and then you repeat those exercises, and you have a short recovery period, and you repeat the exercises. And typically these HIIT workouts are maybe like 15 to 20 minutes long. We don't go past 30 minutes when we're dealing with adrenal fatigue. Breath work is another great thing that you can do for the body because it literally calms your nervous system. There are a lot of apps out there that you can put on your phone that have great visuals. They'll talk you through different forms of breath work. If you have an Apple Watch, there's actually something called Breathe on here. And a lot of times I'll just go to it while I'm waiting in like carpool line or something like that and just practice the breath work then. But especially if you notice like you start to feel those feelings of anxiety or to feel that feeling of stress, gosh, just excuse yourself for a few minutes, do a minute of deep belly breathing. So when I say breath work, what we're talking about specifically, if you'll take your hands and if you'll put them on your stomach and take a deep breath in and let it out, your objective is to have the belly go out and not the chest. So chest breathing or lung breathing tends to be more shallow than the deep breathing that helps to bring anxiety down and then can possibly have a positive impact on your cortisol levels. It's very easy to practice, and it's really good if you struggle with sleep. And sleep brings me to my last pillar of recovery. I cannot emphasize this one enough because sleep is literally designed to be the place and the time where your body heals and recovers. In a perfect scenario, if you're struggling with adrenal fatigue, you would go to bed as early as you possibly could. Like once you got sleepy, you'd go to bed and you would sleep until you wake naturally in the morning, hopefully by 9 or 10 a.m. We're talking about that much sleep. But obviously and sadly, we live in a world with alarm clocks and schedules and demands. And for many of us, this used to be the place that I lived in for years. The most difficult part of my day was that morning routine because I didn't have to just get myself ready. I had to get 2 kids ready too and get them to school and to childcare and myself to work. And it was the time of day where I honestly had the least amount of cortisol, the least of the very thing that I needed to have to get up and get going was happening at a time of day when I needed it the most, when I was under the most stress. So I know that, like I said, we don't necessarily live in a perfect world. It would be good if you could practice that on the weekends though. But if it's not possible, then your regimen or your homework assignment is going to be good sleep hygiene. This becomes critical because you literally want to train your body how to go to sleep at night and how to stay asleep at night. So going to bed at the same time every night, start to train your body. Like, just train your body. Figure out a good bedtime for you. Don't stay up too late. Even if you're having a difficult time falling asleep, start to train your body that this is bedtime and this is when we start to wind down. Screens off for an hour before bedtime. Don't watch TV. For God's sake, don't watch the news right now. If you just have to be on your phone or got to do some kind of work or whatever, I don't have mine out here, but wear the blue light blocking glasses. You can order like a 2-pack of those off Amazon for cheap. And if you don't know what I'm talking about when I talk about blue light is the light that we get that comes off things like lights, but it's the light in particular that we get off screens like TVs, phones, iPads, etc. And it does not, it suppresses the stimulation of melatonin, which is the hormone that helps your body to fall asleep and stay asleep. Now, you may be thinking, oh, I can hack this and I can take melatonin. Melatonin is actually not something that I recommend taking long-term because it can mess with what's called your body's feedback loop, meaning if you start supplementing with that hormone, it could be that your body starts to say, oh, we don't need to make that anymore because she doesn't need it. And that's not a situation that you want to end up in. So another thing is that studies have shown that the ideal room temperature for sleep is around 65 to 68 degrees. So make sure that your room is cool enough. There's nothing worse than that. Throwing the sheet or the comforter off, putting it back on. I mean, you're never going to get into that good, deep, healing sleep if you're fighting with temperature all night long. Side note here, if you are somebody who, let's say you fall asleep pretty easily, but on a pretty regular basis, you find yourself jolting awake sometime between 2 a.m. and 4 a.m., somewhere in that window, and then you may or may not be able to get back to sleep. You may be fitful for the rest of the night. That is a sign of a blood sugar issue. It means that there's not sufficient blood sugar to help because during the night, your cortisol levels when you go to sleep should be at their lowest, but they should start climbing back up through the night so that you wake up, sun's up, get going during the day. If you're waking up in the middle of the night like that, my suggestion would be, one, address your blood sugar issue at the root cause. But a way to hack it temporarily would be to have a protein-rich snack, maybe like an apple with some nut butter or a protein shake or something like that before you go to bed, because this can help your blood sugar levels stay stable throughout the night and help you to avoid waking in the night. Oh, I told you that was my last one. It wasn't. Sorry. This is the last one. Grounding or earthing. It can be either one. You can look it up. It is basically the practice of walking barefoot on the ground outside, typically either in grass. If you lived on the beach, you could do it in sand. In West Texas, we could do it in dirt. But it's just what the word says. It grounds the body. It grounds the nervous system. It's preferred to do this in the morning, especially on grass that is dewy, has some moisture to it. It may sound weird and like new agey and all of that, but they've actually done thermal imaging on people what their body looked like before they did a grounding practice, and it shows systemic inflammation, and then they image them immediately after a grounding session, and the thermal imaging shows that inflammation has gone down significantly, and it can help to produce feelings of calm and of peace. So I want to thank you all for making time to be part of this call, whether you joined us live or you're going to catch this on the replay. I'm glad that you made it a priority for you. I have said over and over again in this page, but the purpose and my heart for starting this page is to help you feel informed and educated so that then you feel empowered to advocate for your health in a way that makes you feel heard and ultimately helps you heal or helps you get better. If you are not currently taking supplements and you have interest in learning about the supplements that I have personally used, I would like to invite you to do a call with me to help you better understand how stress affects your body and how you can work towards balancing your hormone systems through nutrition and supplementation. Make sure that you let me know in the comments if you watch this live, if you watch the replay, and if you have any questions, you can also leave them in the comments and I'll try to get back to them over the next couple of days. Have a wonderful evening and get off that stress express, y'all. Good night.